Daily exercise is something I swear by, and in my case it's walking. And whilst it's good for staying fit, it's also great for my life balance and general well-being. And just because I can power up this hill with relative ease, it doesn't mean that I enjoy perfect health. Why? Because I've got Crohn's disease. Crohn's disease is an inflammatory bowel condition that causes chronic inflammation of the gastrointestinal or GI tract. It can be painful and debilitating, occasionally leading to severe complications. There's no known cause, and unfortunately there's no cure. Crohn's typically first appears in younger people, and whilst it's a lifelong condition to manage, there are however some treatments available to control the inflammation. In my case, since first being diagnosed back in 2002, I've been quite fortunate because my situation has remained stable or in a state of remission, and it's been managed with daily medication and regular checkups, which have enabled me to live a relatively normal life with minimal symptoms and issues. However, the situation has changed somewhat for me in the last year or so stick around and I'll explain a little bit later in the video. Why am I telling you this? Because this is a lifestyle channel, guys, and as I said in one of the earlier videos, health was going to be a focus area because it's a simple reality for us middle-aged somebodies. Secondly, I'm probably just as normal, just like you. I've got something that I need to deal with and manage. But overall, I'm somebody that listens to my body, and when something's not right, I go and see my doctor. As I've also said on the channel, I want the rest of life to be the best of life. Well, after a regular checkup earlier this year, yes, that's a colonoscopy in case you're wondering, the specialist informed me that the situation internally has changed somewhat. So what's happened is a tissue or an intestinal stricture has started to form on the intestinal wall, bowel, etc., and it's causing a narrowing. If it continues to manifest without any treatment, it'll not only compromise my digestion and create abdominal pain, but it actually can become cancerous. And whilst the C word is probably the worst thing a doctor can tell you, in my case, I'm somewhat fortunate because we have an opportunity to eliminate it before it even starts to develop. So last week I had an appointment with the specialist, and here's how it went. Okay, so I'm here outside RPH Medical, which is Sydney's epicentre of all things medical, clinics, hospitals, etc. And I've got an appointment with the gastroenterologist, so it'll be interesting to see what he says. Given it was 6 months ago since I had my last internal checkout, if it's true to form, he'll probably want to have another look. So let's go inside and have a chat, and I'll report to you when I'm done, and hopefully I can actually take a little bit of footage when I'm in there. Wish me luck. Guys, if you're liking the video, I'd really appreciate it if you can give it a thumbs up, a like, hit the subscribe button. Aside from helping the channel, it enables YouTube to put videos like this in front of more people like you. Thank you. Talking normal.
Yeah, so if you've got your bowel, and this is sort of, we've sliced it across here, so this is where your all your feces is going down the middle, and normally you've just got these little narrowings as it goes along.
Yep.
You've seen the shape of the poo, so you know what it looks like.
Yep.
And then with a stricture, you've got this normal wall thickness here becomes exaggerated. So
right.
You might find that whole wall thickness comes out like that,
yep.
and this whole wall thickness comes out.
Right.
So the calibre of the inside of the bowel is much narrowed.
Yes.
Now, what we worry about is that might be narrowed because of what we assume it's from inflammation, and certainly all the biopsies that you've had show that it's nothing more than inflammation.
Yep.
But the literature tells us that we need to worry that there might be abnormal cells in there, like a cancer that might be growing. Now, that's why we go in and we biopsy it as much as we have, and we've never seen any abnormal cells at all, right? Yep. So we can be very, very confident about that.
Yep.
That there is the stricture.
Right, gotcha.
Yeah, that's the narrowing right there.
Yep.
Yeah. This is where we're right inside the stricture, and you can see here it's a bit narrow, whereas if we look at this photo over here, there's more room, and so we take lots and lots of biopsies from in here just to make sure there's no abnormal cells there.
The specialist did explain, however, that he recently had a patient in their early 60s where, despite numerous checks and negative biopsies, cancer was discovered. So he emphasised the extremely vigilant approach we need to take.
Okay, well, as anticipated, yes, I've got to go back in 3 weeks' time to have another inspection. As you saw what the specialist said, there is still a chance down the track that I may need to have that operation, but we'll find out again in a few more weeks' time. I'm going to put that as another instalment in this journey, and I'll get back to you on that then. So where does this leave me? Well, if we continue to do the checkups every 6 months and the situation remains stable, the biopsies come back negative, we can leave things as they are and continue to do the wait and watch approach. Or If the situation manifests where the wall of the bowel narrows further, surgery unfortunately will need to be required. So how do I feel about this? Well, the surgeon gave me a pretty simple analogy, and he said, imagine the journey to cancer is a 5-stop station train ride. And he said, right now you're at the first station. If we discover that you're moving towards the second station, that's when we'll need to take action and do the operation. So my reaction is somewhat philosophical about that. Whilst in life we can't see what's around the corner, but at least in this situation we can actually see what might actually be on the distant horizon. No one wants to hear the big C word when you're chatting to your doctor, but at least in this situation it can be foreseen and there's an opportunity to actually prevent it and stop it dead in its tracks. The surgeon is also confident that in the event surgery is required, it will be keyhole surgery with minimal invasion and luckily a speedy recovery. So what's next? Well, I'm due to go back in for another checkup in the coming weeks, and hopefully the outcome of that will be as per last time and we can continue the watch and monitor approach. I'm also going to make that the topic of a future video so I can keep you up to date with all future development. I'll also leave some links and information in the description box relating to Crohn's disease in the event this affects you or somebody close to you. So guys, if you like what you've seen in the video today, be sure to give it a thumbs up, hit the subscribe button, and I'll see you in the next video. Bye for now.